So here you are going to watch Coblation adenoidectomy in an 8-year-old child, and you can see this is a grade 4 adenoid. I have already performed tonsillectomy, and there's no space for the when they want to go in. So now I am first debulking the adenoid with Coblation plasma Smith and Nephew at a setting of 9 for ablation. You can see this is a grade 5 adenoid, completely, in fact, entering the nasal cavity from the nasopharynx. So I'm first debulking, and there's no space for me to even move the wand. So as I create a little space, I'll be able to move the wand. Now I am able to move the wand at least. I'll come to the superior part first, near the superior boundary. And now I have good amount of space to move the wand. That's the superior boundary, which is the periosteum below the sphenoid bone. Can you pour a little water, sister? Saline. Thank you. That's the superior boundary. You can see it very well. Little bit of saline, sister. Thank you. So layer by layer, I'll be removing the tissues, because there's no space for me to move the wand. Can you pour some saline? All right, thank you. That's good. Now you see, now that's the eustachian tube. This is the torus tuberous. That's the superior boundary completely cleared. Now let me debulk a little. And now life becomes a little easier because now I can move my wand. That's the lateral boundary. So after a bit of debulking, I'll define the lateral and the posterior boundary now. That's the superior boundary. With the torus tuberous, this one. So here, that's the eustachian tube orifice. So I'll remove the lymphoid tissue from the torus tuberous only submucosally. I'll not open up the muscles. I'll reach the muscle, but I'll not touch the muscles, and I'll remain 4 to 5 millimeter away from the eustachian tube orifice. Can you see that? So there's no damage to the eustachian tube orifice, and here I'm only reaching the muscles, I'm not opening up the muscles. So that's the complete clearance of the lateral boundary anteriorly. And then from here, I'll follow this lateral boundary and try to reach the fossa of Rosenmuller, which is the lateral boundary posteriorly. But before that, I have to make sure that I do not leave too much of tissues on the torus tuberis. And the inferior boundary is the Passavant's ridge, which is here. So obviously, I need to debulk so that I can see everything in perspective. Now I'll go towards the fossa of Rosenmuller on the left side. This is all tissue inside the fossa of Rosenmuller, which I need to remove layer by layer. Keep debulking so that you get a perspective. And the adenoid is pretty vascular, but because of the coblation, there is no bleeding. And now, as we go deeper and deeper, I'll get the buccopharyngeal fascia at the back. That will be the posterior boundary. And laterally, I'll get the uh, fossa of Rosenmuller. So we need to make sure that there's no recurrence, and therefore we'll remove all the tissues till the boundaries. Now that's the inferior boundary. And very soon I'll be reaching the posterior boundary. So I'll go little careful. I'll be a little careful here so that I do not open up the buccopharyngeal fascia. That's the buccopharyngeal fascia, hopefully. I'll just take a minute more to define the buccopharyngeal fascia. That's the fascia very, very clearly seen. My aim is to only define the fascia and not to open it. And similarly here, aim is to only define the periosteum but not to open it. That's the fossa of Rosenmuller. That's the inferior boundary. So I'm going simultaneously on all the boundaries, layer by layer. I'm not digging at one particular place because then you'll not get a complete perspective. And perception of depth is very, very important. There's still some amount of tissue here in the fossa of Rosenmuller and behind the torus tuberis. See, I have reached the fascia. Can you see this? I have reached the fascia. That's the posterior boundary properly defined. And that's the fossa of Rosenmuller almost cleared. Now, there's still some tissue at the back of the torus tuberis. So I'm going slowly. Now let me see and define the buccopharyngeal fascia completely. Alright. Now laterally I have to be very careful because most of the vessels come from the lateral side. So depth of the on the lateral side in the depth you can just coagulate. You need not ablate everything. Now you see the fascia almost entirely on the posterior boundary. I have reached the fascia, but it's not opened anywhere so far. So obviously there will be no pain and no bleeding, and there will be no recurrence as well. I still need to remove the last layer very carefully. Now that's the fascia. Still, the last layer of lymphoid tissue is still there. I'm being very careful not to open up the fascia, but at the same time I want to remove as much lymphoid tissue as possible right till the boundaries so that there is no recurrence. Alright, so the fascia is almost defined. There is a very small amount of tissue still there. Alright, so left side is almost done. I'll just coagulate a little bit more on the torus tuberous so that there is no regrowth of this lymphoid tissue in the future. And if I see the tissue to be significant, then I'll ablate it. Whatever significant tissue I'm seeing, I'm ablating. So that's the adenoidectomy completed on the left side. Thank you for watching. Now I'll do the same thing on the right.